Measles is a highly contagious disease that can lead to someone being hospitalized, and this outbreak is spreading in communities throughout the United States and around the world right now. So here to further educate us is the Director of Health, Dr. Fredrick Echols. Welcome, Dr. Echols.
Thank you. My pleasure.
So, we're hearing a lot about measles right now. It's kind of a big topic and it's unexpected. It's not something we really hear about that much because we just expect that that's something in the historical past as a disease. So what's going on?
Yeah, so as you mentioned, in 2000, the measles was considered to be eradicated in the United States.
In the year 2000, around then?
Yes.
Okay.
Yes. Since that time, we've had, there's been increased in international travel. There's also been increased issues with individuals complying with vaccine recommendations, et cetera. And so what we end up having is pockets of populations within our jurisdiction that are unvaccinated.
So it's interesting what you said. It was eradicated in the United States. But that doesn't mean throughout the world, and like you said, people travel.
Correct.
And in our last segment, we were talking about world travel and international travel. It's so easy right now to just cross borders and jump on an airplane. So I don't know that we think enough about how easy it is to bring disease right back here. Absolutely.
And so we've seen that a lot over the last few years with individuals being exposed to not only vaccine-preventable diseases, but also emerging and re-emerging infectious diseases such as Ebola. And so when individuals, they're not properly screened or not properly vaccinated, and they travel to another jurisdiction, the risk of exposing others who may not be vaccinated is a risk that we have to be mindful of. Mm-hmm. And so what we do at the City of St. Louis Department of Health is to make sure that individuals across all of our communities are aware of the current recommendations that are provided by the Centers for Disease Control and Prevention, as well as other federal agencies that provide guidance on infectious diseases.
Okay, and to put a little bit of some data behind what we're looking at right now, we do have, you provided us with a graph that we can pull up and take a look at what's going on with measles right here. We can see it shows up to 2019. But something was going on in 2014. Tell us about that.
Yeah, so in 2014, there was a large measles outbreak that occurred in California at Disneyland. And this occurred, there was international travel was associated with this particular outbreak as well. And so what happened was you had an individual that came while they were infectious, exposed a lot of people, and then those individuals that were exposed who may not have been properly vaccinated or under-vaccinated went back to their respective communities across the U.S. and across the world, and then you had subsequent outbreaks that emerged from there. And so that was a huge undertaking because it didn't require participation from local health departments as well as state health departments as well as the Centers for Disease Control.
Okay.
And as you can see in 2019, 704 cases have been reported this year, and this is as of April 26th. So additional cases may be identified.
We've got a long ways to go.
Right, and it's really important because we haven't seen this number of cases in over 25 years. So this is really a remarkable event that's occurring in the United States.
Okay, yeah, and it is very compelling when you think about the fact that it's only, like you said, we're not even halfway through the year. And
Absolutely.
it's something that we need to take seriously.
Right.
And what are some of the symptoms of measles, things that we should be aware of?
So some of the symptoms are non-constitutional, so they're just generic symptoms. So individuals can have cough, red eyes, but the telltale sign is a rash, and the rash typically starts from the forehead and kind of spreads down through the trunk, and that's one of the major symptoms that's associated with measles.
Is it an itchy rash? Is it like chicken pox?
It's typically not itchy, and so and one of the challenges, again, this is a vaccine-preventable disease. So after the measles, mumps, rubella vaccine was introduced into society, as individuals were getting vaccinated, physicians just didn't see it as much. And so for newer physicians that are graduating from medical school, they're only experience with this is something in a textbook. And so
Right.
sometimes when you see individuals, they might not have the textbook appearance. And so these measles can be easily misdiagnosed as something else.
Absolutely. We're going to take a quick break, Dr. Echols. We're going to come back and we're going to talk more about how to prevent measles right here in our own homes and communities in St. Louis. So thanks for joining us, and stay tuned for more from Dr. Echols.